Ever wondered why you get sinus infections? The answer might not be as straightforward as you think. Sinus infections, or sinusitis, are a common but complex health concern, influenced by a variety of factors. Imagine your sinuses as air-filled cavities in your facial bones. When these become blocked, they create the perfect breeding ground for germs, including viruses and bacteria, leading to sinus infections. Viral infections are the main culprits behind most sinus infections. Common cold and flu viruses can cause inflammation in the sinus linings, leading to symptoms such as nasal congestion, facial pain, and a runny or stuffy nose. But viruses aren't the only troublemakers. Bacteria can also instigate sinus infections. Often, bacterial sinusitis occurs as a complication of a viral infection. The usual suspects in such cases include Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. In individuals with a weakened immune system or underlying health conditions, fungal infections might be the cause of sinusitis. Although it's important to note that fungal sinusitis is relatively rare compared to viral and bacterial causes. Allergies too play a role in causing sinusitis. They can lead to inflammation and congestion in the nasal passages, making the sinuses more susceptible to infection. Anatomical issues such as a deviated septum, nasal polyps, or narrow sinus openings can also increase the risk of sinus infections by obstructing proper drainage. Last but not least, environmental factors come into play. Exposure to pollutants, smoke, or irritants can contribute to sinusitis by irritating the nasal passages and sinuses. When it comes to treatment, the focus is usually on managing symptoms and addressing the underlying cause, be it viral, bacterial, or otherwise. In some cases, antibiotics might be necessary if the infection is bacterial. However, the key takeaway here is that if you're experiencing persistent or severe sinus symptoms, it's crucial to seek medical advice for an accurate diagnosis and appropriate treatment. And there you have it, a comprehensive look at the causes of sinus infections. From viruses and bacteria to allergies and anatomical issues, sinusitis can be triggered by a multitude of factors. Understanding these causes is the first step in effectively managing and preventing sinus infections.